Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to get into this disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on what is currently being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office with complaints of sudden cough and fever. He states that what he is coughing up is a nasty brownish color. Based on the presentation, what gold standard diagnostic exam should the nurse practitioner order at this time? Is it A, nasal swab, B, a COVID test, C, a chest x ray, or D, an influenza test? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is being asked. And I know a lot of you are like, all right, I don't really want to do that, or y'all don't understand why I'm saying that. But when you read a lot of questions, especially when you're sitting for boards and you have 100 plus questions to complete, you are reading through a bunch of scenarios, and oftentimes we begin to create our own storyline based off of all of the details that's in the scenario. And it could be just fluff and back um, history and resources, but it really doesn't contribute to the question that they're asking you. So I tell you to read the stem of the question so you don't find yourself going down a pathway that you don't even need to visit, right? So, for example, here the stem of the question states, based on the presentation, what gold standard diagnostic exam should the nurse practitioner order at this time? Always pay attention to gold standard when you're studying. I tell y'all to make sure you know those gold standards, okay? Just like your first line therapies. But this patient came in to the office complaining of sudden cough and pain. He's having a productive cough, is brownish in color. This should have you begin to think of community acquired pneumonia, okay? So with pneumonia, you want to do a chest x-ray, right, for your gold standard exam. So C is your best answer. Question number two. The nurse practitioner is reviewing the chest x-ray results of the patient with sudden fever and productive cough. The chest x-ray shows white patchy infiltrates. Based on these findings, how should the nurse practitioner diagnose? Remember what I tell you, when they're asking for a diagnosis in the stem of the question, you need to run it back and look at the assessment findings so you're able to determine a diagnosis, okay? So this patient came in with sudden fever, productive cough, sudden fever and productive cough, right? Chest x-ray is showing white patchy infiltrates. When I say this, you say that. You know how my saying is. But you're thinking pneumonia, right? But remember, with community acquired pneumonia, they have sudden symptoms. With atypical pneumonia, they have gradual symptoms, right? So I always say my Brittany's brilliance for that is with community acquired pneumonia, I think CAP. And so I had to run out of the house really quickly. So I suddenly had to leave. So I threw on my cap. So sudden symptoms, productive cough, fever, think community acquired pneumonia. Okay. So B is your best answer. And lastly, question number three for today. The nurse practitioner has confirmed the diagnosis of community acquired pneumonia. The patient denies any allergies or past medical history. How should the nurse practitioner treat? Is it A, amoxicillin, B, Bactrim, C, levofloxacin, or D, Augmentin plus azithromycin? Take a moment and tell me what you got in the comments, you guys. All right, so here the stem of the question states, how should the nurse practitioner treat? I know I always tell you, when they're asking for treatment options in the stem of the question, you want to first look back and see if they have provided you with a diagnosis. In the event that they have not, you need to take it back a step further, review the assessment findings so that you're able to determine a diagnosis, so then you'll be able to come up with a treatment, right? But here they have provided us with the diagnosis of community acquired pneumonia. Now, with pneumonia, And I consistently do questions like this because I have a lot of one-on-one students who get mixed up on when and what to do with pneumonia. And guidelines changed, so I like to always put it into a question so you can see it and make sure that you're applying what you know correctly, right? So with pneumonia, there's things that you need to look at. Now, this patient doesn't have any allergies. This patient doesn't have any comorbidities. This is their first visit for pneumonia and the treatment, right? So the best answer out of these choices are A, amoxicillin. Remembering when somebody is low risk for community acquired pneumonia, they don't have any comorbidities, they're considered low risk, they're not elderly, anything of that nature, they're not allergic to any of the medicines, you can go with amoxicillin, you can go with a macrolide, you can go with doxycycline. Doxycycline is typically reserved for when we have an allergy to either the penicillin or the macrolide choices, but these are all things that you can utilize up front, right, for monotherapy. Now, they will never give you all of those choices in one, okay? So that's why you don't see me have like azithromycin on here as well, but you can do either or. Now, that's first line. The next line of therapy is when you need more than monotherapy, right? More than one agent to treat. So say this patient, same similar situation, they're coming in for the first time, having a sudden productive cough, fever. They are 40 years old, but they do have comorbidities. Say they do have diabetes, hyperlipidemia. All right, so we're going to give you more than one thing. So that will be a case where you can use like the answer choice D, like augmentin plus azithromycin. You want to give that amoxicillin plus that macrolide, or you can do the, like I said, the augmentin plus the macrolide of azithromycin. That's when you need more than the monotherapy. And then when do we bump up to our things like levofloxacin, that respiratory fluoroquinolone? They call those the big guns, right? So you utilize that when you have your higher risk patients, or like they have comorbidities, they're elderly, they were on an antibiotic in the last 90 days, or they are coming back and you've treated them for community acquired pneumonia and they're returning with the same symptoms and no resolve after any of the previous antibiotics. Then you would go directly to a respiratory fluoroquinolone like levofloxacin, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And if you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in the ebook or paperback option. Both options are linked in the bio of this channel. This is designed for family and adult gero, preparing for either exam, the ANCC or AANP. It is broken down by system. There are charts, pictures, there are interactive sections per system to test your knowledge, as well as medication lists with first line, second line therapy included to help you tie things together, as well as questions with rationales at the end. If you are someone who prefers to do a self-paced review, you like to study on your own independently, on the go, I have an online self-paced course designed for family and adult gero, broken down by system. It's the same concept of going through all of these steps, just like I teach in assessment, diagnosis, evaluation, and treatment. There are videos per system, mini quizzes per system. That's also linked in the bio of this channel. I now offer a Q bank. So the way my Q banks are broken down is you can get the mini practice. There's three different options, or you can go with the bundle. The mini practice quizzes. There are 10 of each. And they're just 10 increment of questions, right? Because it allows you to study. So with these, you do the questions and the rationales are provided in video similar to this, where I am talking you through those steps because I want you to use the mini quizzes as a study resource, okay? Then I have two different practice exams. A full practice exam, 175 questions, and it is designed in the ANCC format, as well as another practice exam with 150 questions designed in the AANP question format, okay? You can choose to get each one of those separately, or you can do the bundle. Of course, the bundle is the better option, in my opinion, because you get it everything, the study part and the idea of each exam, and more questions to practice with. But some people, I divided it out because some people just want to study a little bit. Some people then want to come back later and do a full practice exam. So I have it designed like that. So also that link is available. My 5-week intensive group review, this is the last one for this year. It's linked in the description of this video. I have 3 spaces remaining now for this class. It is starts September 9th, ends October the 18th. It is broken down by system, designed for family and adult general. We do many assignments each day so that you can learn and review in small chunks. Now, I always say, because everybody's schedule varies, so you're able to see the full week of assignments and videos and material. It releases every Sunday evening. So then you're able to access it and complete it however it works best for your schedule. And then I provide feedback based off of your assignments submitted whenever you get them done. And then also each week we do live practice questions as a group. And then that final week is an individualized week. And what I mean by individualized week, have you ever taken a class and you're wondering where you are or how you're doing and how this applies to you? Well, we do these one-on-one sessions at that time, so I'm able to provide advice and feedback based off of the things that you have submitted and go over that material. This provides you with that one-on-one session so that I'm able to say, hey, over the weeks, this is your progress. I've noted these areas. Remember where I submitted this to you. I want you to spend some time on this. Or, hey, I have noticed this and you're ready. Go ahead, get prepared to test. So that's what that individualized week is for. Again, that is linked in the description of this video. And this is our last one. Grab your spot while you can. I like to keep my seats limited for this because I do the individualized week. So I like to be able to provide y'all with that true hands-on feedback at the time. And then lastly are my one-on-one sessions. I always tell you guys to reach out if you're looking for one-on-one, because my one-on-one sessions are customized. So let's determine exactly what you need. They're gauged in several ways. So if you have a weakness that you need to cover, you can book a session for 1 to 2 weaknesses at a time. If you're just looking to gauge where you are as far as preparedness for boards, you can book an exam readiness assessment, or you can do like the custom package, which is the most popular. And it is designed specifically to provide you with a pretest to see where you are, to gauge your strengths and weaknesses. Then, based off of the duration of time that you're looking to allot to studying, I structure a study plan for you for that time frame, and I work alongside with you during that time to take you to a successful exam attempt. So, again, if you're looking for any of those resources, feel free to reach out to us at the Nursing Studio. I look forward to working with each of you. Happy studying. Bye, y'all.